While entering the room, perform hand hygiene and ensure privacy before you proceed with airway maintenance. Introduce yourself to the patient, then identify her using 2 identifiers.
Let's see. Can you tell me your full name and date of birth?
Rose Jones, August 6, 1944.
All right, thanks. How do you feel today?
A little short of breath.
Maintaining a patient's airway begins with good respiratory assessment. Ask the patient if she's having any trouble breathing or any symptoms of hypoxia, such as dizziness, unusual fatigue, or anxiety. You'll choose a non-invasive intervention to help maintain her airway based on her needs. If the patient is not breathing comfortably, try positioning her to promote optimum lung expansion. Help her into the semi-Fowler's or high Fowler's position on the side of the bed or in a chair, with her elbows resting on her knees. If she has COPD, suggest that she lean over a table with her arms propped up until her breathing eases.
Take some nice, slow, deep breaths.
To expand the lungs with less pressure on the diaphragm, have the patient lean over the back of a chair or against the wall. To decrease orthopnea, support the patient's head on 2 pillows when she's supine, or raise the head of the bed to at least 30 degrees. Promote lung expansion and drainage on the affected side by turning the patient at least every 2 hours. If she can tolerate it, position her to allow drainage by gravity. Or, if she needs unilateral re-expansion, have her lie with her good side down and the affected lung up. Controlled coughing is another option to help maintain the airway. With the patient in an upright position, have her lean forward and place a small pillow or just her hand on her abdomen to increase expiratory pressure.
What I'm going to have you do is take 2 slow, deep breaths. And on the 3rd breath, I want you to take that big, deep breath in and hold to a count of 3. And then you'll do 3 consecutive coughs without taking a breath in between.
Instruct her to take 2 slow, deep breaths, inhaling through her nose and exhaling through her mouth.
Okay, 2nd deep. Okay, 3rd breath.
Now tell her to inhale deeply once more. Hold her breath and, on the count of 3, cough deeply 2 or 3 times as she pushes air forcefully from her lungs. Be sure she doesn't take a breath between coughs. If a patient has trouble coughing, teach him how to huff cough.
We're going to do a maneuver to help alleviate some of your secretions. It's called a huff maneuver. What I'm going to do is have you sit all the way up, and you're going to take in a nice deep breath followed by 3 huffs. So take that nice deep breath in and then ha.
Have him take a moderately large breath and then make a h sound as he quickly pushes the air out through his open mouth. Have him repeat this 3 or 4 times and then instruct him to cough. Some patients will require continuous positive airway pressure or bi-level positive airway pressure to maintain an airway. These alternatives are known as CPAP and BiPAP for short. Begin by applying clean gloves and use a mask, gown, and goggles if the patient has projectile secretions. Apply the pulse oximeter and position the patient comfortably with her head elevated.
The bed so it's easier to breathe.
Use a masking chart to determine the correct size CPAP or BiPAP mask. Place the mask over the patient's nose or face and adjust the head strap until the seal is as tight as she can comfortably tolerate. The mask must have quick-release straps. Turn on the pressure generator and connect the CPAP or BiPAP tubing to the patient's mask. Monitor the pulse oximeter reading. Ask her to breathe normally and set the mask pressure as prescribed. For CPAP, the initial setting is usually 4 to 8 centimeters of water. BiPAP typically requires 10 to 15 centimeters of water for inspiratory pressure and 4 to 10 centimeters of water for expiratory pressure.
Ms. Simmons, I'm back to check on your breathing. Are you breathing more comfortably? Is the mask comfortable? Are you experiencing any areas of pressure where it's hurting?
Assess the patient's skin frequently to look for signs of pressure, irritation, and breakdown.
There's no areas of redness. If you have any problems, your call light's right here, so just let us know if you need anything. Ms. Jones, I have a pink flow meter for you. This is a tool we use to assess your breathing. This is something you can also do at home to realize when you need to seek help.
Okay.
To assess the effectiveness of any airway management technique, measure peak expiratory flow rate, or PEFR. Explain to the patient what PEFR is and why it's helpful to keep track of it. To take the PEFR measurement, the patient should be standing. However, if she can't do so, help her into the high Fowler's position or any other position that promotes optimal lung expansion. Then slide the mouthpiece down into the base of the numbered scale. Tell the patient to take a deep breath. Put the mouthpiece in her mouth and close her lips around it to form a firm seal. Have her take a single breath and blow it out through her mouth as hard and fast as she can.
All right. One more time.
Repeat this maneuver twice more and record the highest reading in the chart or in the patient's diary. If the patient is to record PEFR at home, have her demonstrate this technique independently and assess her ability to record her readings accurately on a chart using a traffic light pattern. A measurement in the green zone represents 80 to 100% of the patient's personal best. This means no asthma symptoms are present. A measurement in the yellow zone falls between 50 and 80% of the patient's personal best. Caution is in order. The patient may be having an attack and need treatment. A measurement in the red zone falling below 50% of the patient's personal best leaves no room for doubt. It signals an alert for which she should notify the provider immediately. Help your patient implement the action plan suggested by her healthcare provider. Finish your care by instructing her to clean the flow meter unit weekly, following the manufacturer's instructions. Perform hand hygiene and document your assessment and all actions related to oxygenation and patient education.